Have you ever wondered why your blood pressure seems to rise even when you're trying to relax? Or perhaps, despite your efforts to eat healthy and exercise, you're still struggling with hypertension? You're not alone. High blood pressure, often called a silent killer, affects millions worldwide and can have serious consequences for your heart, brain, and overall health. But what if we told you that managing and even lowering your blood pressure could be simpler than you think? The good news is that the key lies in small, consistent lifestyle changes that can make a big impact. In this video, we'll explore powerful, evidence-backed strategies from top heart health experts, including the American Heart Association and leading cardiovascular specialists, that can help you take control of your blood pressure and protect your heart for years to come. 1. Lifestyle modifications, core elements for managing hypertension. Managing blood pressure is far more than just a routine of taking medication. It involves integrating lifestyle changes that focus on long-term heart health. The American Heart Association, AHA, has emphasized the crucial role of lifestyle modifications in managing hypertension. A study by the AHA found that adopting a heart-healthy diet and regular physical activity can significantly reduce blood pressure without the need for prescription medication in many cases. Dietary adjustments. One of the most powerful ways to control blood pressure is by changing your diet. Research published in the journal Hypertension showed that a diet rich in potassium, magnesium, and fiber typically found in fruits, vegetables, and whole grains helps reduce blood pressure. Limiting sodium intake has proven benefits in controlling hypertension, as excess sodium can cause the body to retain fluid, increasing the pressure within blood vessels. The dietary approaches to stop hypertension. Diet, which prioritizes fruits, vegetables, and low-fat dairy, has been clinically proven to lower systolic blood pressure by an average of 8 to 14 mmHg. Minimizing sugar and unhealthy fats. A high intake of sugar and unhealthy fats can lead to weight gain, which directly impacts blood pressure. Research from Harvard Medical School and Johns Hopkins Medicine demonstrates that a diet high in refined sugar and trans fats is linked to both weight gain and the development of hypertension. In contrast, replacing unhealthy fats with omega-3 fatty acids found in fish or flax seeds and cutting back on processed sugars can help lower blood pressure. Weight management. Excess body weight puts strain on your heart, requiring it to work harder to circulate blood through your body. According to Dr. Paul K. Welton, a leading expert in hypertension from Tulane University, losing just 5 to 10% of your body weight can significantly reduce blood pressure, particularly for individuals who are overweight or obese. For instance, every 10 kilograms of excess weight can increase the volume of blood by about 0.5 to 1 liter, requiring the heart to pump more blood through the body, increasing pressure. 2. The power of physical activity. Exercise is widely recognized as one of the most effective ways to lower blood pressure. The American College of Cardiology recommends at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity activity per week. In fact, regular exercise strengthens the heart muscle, improving its efficiency and helping it pump blood more effectively, which in turn reduces blood pressure. Cardio and aerobic exercises. Studies consistently show that cardiovascular exercises like walking, jogging, swimming, and cycling help reduce both systolic and diastolic blood pressure. According to the American Heart Association, just 30 minutes of moderate intensity aerobic exercise, such as brisk walking, can lower systolic blood pressure by 8.9 mmHg. These exercises also help improve blood circulation and strengthen the heart muscle, which makes it easier for the heart to pump blood without exerting excessive force on the arteries. Consistency and movement. The impact of physical activity on blood pressure is most effective when sustained over time. Even moderate physical activity, such as walking, can have a lasting effect on reducing hypertension. A longitudinal study published in Circulation, the Journal of the AHA, highlighted that regular physical activity can not only lower blood pressure but also improve the overall health of the vascular system, promoting long-term cardiovascular health. 3. Managing stress for a healthier heart. Chronic stress is one of the most overlooked contributors to hypertension. The body's natural stress response releases stress hormones like adrenaline, which temporarily raise blood pressure. Over time, prolonged periods of high stress can lead to consistent hypertension. The American Psychological Association has noted that stress-induced increases in blood pressure can make it difficult for the heart to recover after a stressful event, contributing to a higher risk of cardiovascular disease. Mindfulness and relaxation. Incorporating stress-relieving practices such as mindfulness meditation, yoga, or deep breathing exercises has been shown to lower blood pressure. According to a study published in the Journal of Clinical Hypertension, mindfulness meditation can reduce systolic blood pressure by 10 mmHg in individuals with hypertension. Additionally, deep breathing techniques, like heart breathing, inhaling deeply while focusing on the chest area, can activate the parasympathetic nervous system, which counters the stress response and helps normalize blood pressure. Sleep quality. Sleep is another critical aspect of managing stress and maintaining healthy blood pressure. Research from the National Sleep Foundation shows that poor sleep quality or insufficient sleep can cause long-term blood pressure elevations. Ensuring 7 to 9 hours of quality sleep each night can help regulate blood pressure and reduce the strain on the cardiovascular system. For understanding the impact of harmful habits. Certain behaviors can directly or indirectly contribute to high blood pressure and cardiovascular damage. These include smoking, excessive alcohol consumption, and physical inactivity. Alcohol and blood pressure. While moderate alcohol consumption may not harm your blood pressure, excessive drinking has a significant negative impact. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol consumption increases blood pressure by constricting blood vessels and causing fluid retention. Chronic alcohol use can lead to sustained hypertension, increasing the risk of heart disease. The dangers of smoking. Smoking is known to increase heart rate and blood pressure, as the chemicals in tobacco cause the blood vessels to narrow. Research from the American Lung Association shows that smoking not only raises blood pressure in the short term but also accelerates the development of atherosclerosis, a condition where plaque builds up in the arteries, making it harder for blood to flow. 5. The role of medication and medical supervision. While lifestyle changes are essential, medication may still be necessary for individuals whose blood pressure remains high despite adjustments in diet and exercise. Experts like Dr. Michael H. Alderman, a renowned cardiologist, stress that a combination of lifestyle modifications and medication is often the most effective strategy for controlling high blood pressure. Medications such as ACE inhibitors, diuretics, and beta blockers are frequently prescribed to help regulate blood pressure in patients with hypertension. Regular monitoring. Regular blood pressure monitoring is key to identifying any changes early. The American Heart Association recommends that individuals with high blood pressure check their blood pressure regularly, either at home or at a healthcare facility. For those with a family history of hypertension or cardiovascular disease, more frequent monitoring can help detect issues before they escalate. 6. Conclusion: preventive measures for long-term cardiovascular health. The importance of managing blood pressure cannot be overstated. Consistently high blood pressure is a major risk factor for heart disease, strokes, and other serious cardiovascular conditions. Adopting lifestyle changes such as a healthy diet, regular physical activity, stress management, and avoiding harmful habits can dramatically reduce the risk of hypertension and improve long-term heart health. By being proactive and seeking professional medical advice when necessary, individuals can manage their blood pressure effectively, reducing the risk of serious cardiovascular events and leading a longer, healthier life. At the end of the day, the health of your heart is in your hands. The strategies we've discussed, whether it's through adopting a heart-healthy diet, staying physically active, managing stress, or making smart lifestyle choices, are not just theories. They are scientifically proven methods to lower your blood pressure and protect your cardiovascular system. As you reflect on these insights, remember that small, consistent changes lead to big results. The path to better heart health begins with awareness, and it's never too late to start making a difference. Now, here's the most important advice: take action today. Whether it's scheduling a checkup with your doctor, incorporating more movement into your day, or rethinking your diet, your heart's future depends on the choices you make now. Share these insights with your loved ones, because when it comes to heart health, we're all in this together. Help your family, friends, and those you care about understand the significance of blood pressure management, and let's empower each other to live longer, healthier lives.